cardiologist, I've been really impressed by the fact that there's such an abundance of scientific evidence that is so strong, even evidence that is causal, that links air pollution to cardiovascular disease. And this is a hard thing to prove because it's hard to do a randomized controlled trial when it comes to air pollution, right? You can't randomize people to have air pollution or not. But when you look at epidemiologic data and you look at mechanistic studies, you can see that air pollution, particularly particulate matter 2.5, which is the fine air pollution, has a causal dose-dependent relationship with heart disease, all kinds of heart disease outcomes, including MI, stroke, arrhythmias, heart failure, even with dementia and longevity, actually. But it doesn't just stop there. It's not just that air pollution, it's the ozone that can affect it as well. And we've also seen a shift in climate patterns happening over time, where weather patterns are changing more than they've ever changed before. So extreme heat can increase susceptibility for individuals with coronary artery disease or congestive heart failure. And extreme cold can actually increase susceptibility for those individuals and increase risk of stroke as well. And those are all the direct effects of, weather change, air pollution, climate change. There's even indirect effects because people could have trouble getting their medications. People could have trouble, having issues with supply chain issues with medications getting delivered. They could have trouble getting access to care. So there's obviously a lot of indirect effects as well. So it's not surprising to me that the World Health Organization calls this one of the most environmentally biggest sort of threats to human health, which is air pollution. Well, when you think about what's happening, especially with air pollution, you're inhaling those fine little particles into the alveoli in your lungs. There, they actually essentially go through gas exchange and get into your bloodstream directly. They can obviously cause inflammation in the nares, but once they get into your bloodstream, they can have a very activating effect on the blood vessels. And we're talking about endothelial activation, increased expression of adhesion molecules. We're talking about inflammation inside the endothelium. But it doesn't just stop there. We can actually talk about plaque instability because it can cause more plaques to rupture. We can even talk about the effects on the autonomic nervous system, because when those little air pollution particles are swimming around inside your bloodstream, they're turning on your autonomic nervous system to raise your blood pressure, to raise your heart rate, and again, to have many of those sympathomimetic responses, which can activate renin and angiotensin and aldosterone, which we know has been linked to a whole host of problems. So it's really quite a significant impact on your endothelium in many different ways, and that results in sort of downstream effects on your risk for cardiovascular death, major adverse cardiovascular events, even conditions like dementia. I would say we're all vulnerable to climate-related cardiovascular risk, but certainly there are some that are more vulnerable. So that would be our elderly patients over the age of 65 because they have trouble with thermoregulation, regulating their body temperature. Anyone with pre-existing medical conditions. So if you already have a predisposition for coronary artery disease, atherosclerosis, heart failure, hypertension, diabetes, metabolic syndrome, all of those put a target sign on you because your inflammation's already kind of amped up, and then you're getting exposed to that air pollution. Certainly racial minorities and people who live in sort of socioeconomically disadvantaged areas, because it ends up being a medical island. They don't have the same kind of access to care. They don't have the same kind of health literacy either. Pregnant women are certainly high risk as well, because they're not just, of course, breathing for themselves, they're breathing for the baby as well. And a lot of this air pollution can have effects on the baby. And then children, because their nervous systems, their immune systems, all of their organs are developing. So when you expose a child to air pollution, the dose of air pollution that a child gets obviously is much higher than the same amount of air pollution exposed to an adult that has a larger volume of distribution. So all of these populations, I think, deserve special attention, but we should all be mindful of our risk of air pollution. This is where I think clinicians fall short. I personally, as a clinician, I take responsibility for this as well, because we forget that air pollution is a modifiable cardiovascular risk factor. So I think clinicians have two roles here. The first is to assess the degree of air pollution exposure, especially if you're practicing in an urban environment. You have patients who live near the highways, but even in rural areas where you can see more wildfire smoke and such, which we know has been linked to adverse outcomes as well. But the first is to assess, and the second is to educate. So you have to figure out how much air pollution they're being exposed to, and then teach them, because we forget that air pollution is a modifiable risk factor, teach them that they can actually control how much air pollution they're exposed to by looking at metrics like the air quality index, looking at the time of day, looking at whether there's a wildfire outside that's not a day to go outside, especially for somebody who has heart disease or lung disease or other comorbidities. So I think clinicians need to make that part of every history and physical, where they're asking and then they're actually counseling and advising patients what to do to modify their risk.